Cool. Okay. Then I started it.
Hopefully, I don't think we get points taken off for anything if it's like longer than it needs to be or anything like that.
No, I don't think so. Yeah.
Okay. Let me pull this up. Okay. I mean, I feel like most of these have like obvious answers.
Yeah. Yeah. It should be.
Um,
Yeah. We'll see.
like there's not much to debate.
Yeah.
But we'll see. So the first one, I actually didn't read this one. I read the other ones. So should we read it out loud?
Yeah, sure, if you want.
Take
I
turns
read.
reading it?
Yeah.
Okay, I'll do this one.
Okay.
So one of the more popular ethical theories in bioethics, sometimes called principlism, utilizes the 4 principles of bioethics. Do you want me to read this part?
It's
I'll
up
just
to
read the
you.
next part.
Yeah.
So Sally arrived in the US 1 week ago. She's pregnant with twins and in the middle of a very dangerous delivery process. It is common for persons from developing countries to visit the US to give birth. Reasons include desiring their children to have US citizenship and wanting the superior and free medical care, although medical care is not free. Right, okay. The blah, 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 blah. Sally speaks little English and is there with her English-speaking brother. Her brother seems to always be on the phone with family back at home. The physician knows that Sally is from a country/culture where women are afforded few rights and where they're expected to be under the authority of their husbands. A complication occurs midway through delivery and there are 2 treatment options that the physician must offer to the patient. One option offers a 90% chance that Sally will survive and a 70% chance that her infants will survive. The other option gives her infants a 90% chance of survival, but Sally only a 30% chance of survival. Sally wants to do the second option, but the physician is highly suspect that she is being pressured to say so by her family. What should be done?
Okay.
I mean,
So I mean, to start, the first thing that came to mind when I read this was like, is there any way to get a translator, right? I feel like the best
sure.
way to like keep the patient's interest at heart is to make sure you can actually understand her and her words.
Yeah.
And you can never trust what a translator, like a family member, is saying
Right.
when they're translating.
Yeah, I would agree. But then if they can't get a translator, how would you navigate that?
I feel like if he has some like background knowledge of her culture to be like, okay, I know that this is usually how it goes. I think in this case, you're putting your patient first and your patient is the mother first, right? Like, so you would want to do what's in her best interest.
Yeah, I would say it's similar to like do the most good for the most people, and I think the 90-70 versus the 90-30, I mean, it's obvious which choice would be better, and I think that it would be okay for the doctor to have some discretion and just be like, all right, well, I'm just going to do what I can to save both of them, rather than, because the 30%, like, why would that even be something that anyone chooses?
Yeah.
I mean, I understand for 90% survival of the twins, but
yeah, exactly what you're saying. Because if there's a higher percentage for both sides to live, then that's probably what you would want to go for as the doctor.
For sure. Yeah, I would say even like only if you can't get, even if she said that though, that she was okay with the 30% chance of survival, I wouldn't even feel comfortable doing that.
I was gonna say, yeah, because like, wouldn't he necessarily be at fault if he chose that route when there was another route where there was better chances for both?
Right. So it's, I don't know. But then would it be wrong to?
Because she says that she says, quote unquote, that she wants the second option.
I wonder what they are legally supposed to do in that situation.
Yeah.
Like what?
I feel like ethically, like you said, it's a pretty clear answer. You would want the highest percentage chance for both parties.
Yeah. I would
legally,
say so.
I feel like it's also what you said. It should be the same deal.
Yeah. I mean, the only problem would be like if he chose to do the first one against her wishes and then like something happened to the babies.
Hmm.
But I mean, she couldn't really do much because she's not a US citizen anyways, which
Yeah.
sucks.
Yeah.
That would just be an awful situation altogether.
Yeah, that would.
But yeah, I think I stand by what we decided.
First
Just do the first
option
option.
would probably
Yeah,
be,
it's
yeah.
really fishy that
Yeah.
anyone would choose the second.
Yeah. Yeah. Okay.
Okay.
Do you want me to read the second one?
Sure, go ahead.
Okay. A father is seeking full custody of his 4-year-old daughter. Currently, the custody arrangement is 50-50. The father argues that because his ex-wife is an ER physician, she might expose their daughter to COVID. Moreover, the father lives with his elderly grandmother who is at high risk for COVID because of her age. The mother argues that she takes all safety precautions and that COVID is a low risk for children. Ooh. She also complains that she is being punished for being divorced because if she was married and doing the same job, there would be no risk of losing custody of her child. She further points out that the separation would be bad for her daughter's mental health. The father argues that the mom and daughter can FaceTime and that this is only temporary and for the sake of everyone's safety. What should be done?
What do you think?
I think in this case, you would want to put the child's health first. If there's no need to risk the exposure to COVID, then why not keep her with her father for a little bit? That's how I see it, just because and if, okay, so then you see, look at the other side. If they were married, you have no other choice, right? But now you do have a choice, so wouldn't you want to lower that exposure risk even more?
I'm thinking because kids are at such a low risk of developing severe symptoms
mm-hmm.
that it's just like a whole traumatic event that she's going to go through that she doesn't need to go through, like separating from her mom
mm-hmm.
for who knows how long. We didn't know it was going to be, we didn't know the pandemic was going to be this severe for the entire year. Like, who knows how much longer it will be happening. So I'm thinking, like, when I was a child, I just feel like that would have been traumatic.
Yeah.
But I understand wanting to separate her because you don't want to get her sick. But I would say just keep. I don't know. If it were my kid,
mm-hmm.
I would just not
the
do
50-50.
Yeah, just keep custody half and half.
Yeah, I feel like obviously in this case, I don't think there's a wrong answer because that's pretty much what we're all living in right now. It's like no one knows really what to do. I don't think there's any wrong answer, but personally, I would be like, I feel like it would be selfish for me to want to keep my daughter there.
Yeah.
You know what I mean? Like she'll be fine. Like it won't be like horrible. It'll be hard for everyone, but like if she gets to see her dad and her grandma versus just her mom,
But she would get to see both of them anyways.
But doesn't the grandma live, or am I?
The grandma is like at high risk. She lives with the dad, but I thought the choice was to stay 50-50 and keep seeing both of them, or to only stay with her dad, right?
Yeah, so that's what I'm saying. Like if she were to stay with the dad, she would get to see the dad and the grandma. And if she were to stay with the mom, then I'm sure the dad would be like, okay, then.
Like nervous to not.
Yeah, because if the daughter gets it, she'll probably be fine. But like if the grandma gets it, she's at way higher risk. That's how I'm looking at it. But again, no one's obviously no one wants anything malicious in this.
Right.
So.
Yeah, I don't know. I guess it probably would be best in that case for the mom to just allow her daughter to stay with her dad, I suppose.
But I also think
it it would suck, because then
Yeah.
when are COVID cases going to be done? And also, working at a hospital, you're always exposed to things like that. So
Hmm.
previous to COVID, there were still infectious diseases that her mom was exposed to.
Hmm.
It just wasn't as, obviously widespread and dangerous,
Hmm.
or we have treatments for it.
Yeah. But that's
So
what makes this scenario so like different, right? Because like there was like, oh, we have a cat
sorry.
too. So do I.
Yeah,
He's back
too.
there.
Aw, yeah.
Um, like right now, COVID is still like pretty new. A lot of people haven't ever like experienced before.
Mm-hmm.
Things still aren't like completely known about it, like the best way to like deal with it. I feel like at this point probably, yeah, they have a pretty good idea. I don't know.
Yeah, we still don't have like technically a treatment for it. So I
Hmm.
think that's why people are still freaked out, because there's just so many unknowns.
Yeah.
But I'm thinking like there's no like end in sight per se.
Hmm.
You know what I mean? So if you're
Yeah.
separating her, it's going to be for what? For
Who knows?
however long it's around? Yeah.
Yeah. Yeah.
So I don't know.
I don't know either.
Right.
Again, I think it's a different situation because they have the choice. A lot of families right now don't have like my family in California. My aunt works in the ICU, so she's dealing with COVID patients every time she goes into her shift. And she lives at home with my uncle, her two sons, and my grandma.
Mm-hmm.
So it's like there's nowhere else anyone can go. Like we can't take my grandma anywhere. We can't take her. Like she can't live anywhere else. Like so they have to live there and they have to deal with it, and it's fine, or it's been fine up until this point.
Yeah. Honestly,
So.
my one of my friends, her uncle is a nurse and he works in the ICU in the COVID unit at Banner Boswell, I think. And he lived with his in-laws at the time, and so did my friend.
Mhm.
And whenever he came home, they made him like strip before he got in the door, put his clothes in the washer, and then go straight to the shower, just to be sure. Which
That's what my aunt does. That's exactly what she comes through the garage. She literally like because they have the washer and dryer in there. She like strips naked, throws her stuff in there, and then like they leave out like a towel and stuff for her to like run to the bathroom to shower really quick.
right. So I mean, if you take all the precautions, I don't really think it's that big of a risk. I mean,
Yeah.
more so than us going out and being exposed to people all the time that probably have it, you know?
Hmm. Without the proper. Like,
Yeah, we don't have any PPE,
yeah.
like we're
Yeah.
just
Yeah.
one mask, yeah.
One
And
mask.
we definitely shower every time we come home, so
Yeah. And people don't really wear the mask correctly, anyways, or wear the right kind of mask. So
right.
that's a whole other deal.
Yeah,
So I don't.
yeah, that's tough.
That is tough.
I think it would depend on, maybe like ask the kid, like, how do you feel about this? Would you be really upset? Would this be a problem?
Hmm.
And if it would be, then I would just continue the 50-50. But the grandma thing, I guess the child could like shower before she
Yeah.
interacts with her grandma. I don't know.
Yeah.
Or wear a mask around her just in
I think
case.
that all comes down honestly to like trust. I feel like
Mhm.
between the husband and the wife.
Yeah.
But
Which
yeah, like if you want to be absolutely sure, of course, yeah, she should just stay with the husband. And if the mom
yeah.
is okay with that, then I feel like that would be the way to go. But if they both feel that strongly, then it's like, okay, we're going to have to trust each other here.
Yeah. Yeah, I would honestly just leave it up to the kid at that point.
Yeah.
Like, what do you want to do? Let me tell you all of the, I don't know if it's how old
She's
she
like
is.
4. The
Is she
poor,
4?
yeah, she's like 4.
Oh,
Oh.
whoops. I was thinking, oh yeah, she is 4. Okay, so she's definitely not going to know the answer,
Yeah.
but I don't know. I would say either way, it would be fine.
Mhm.
It would probably be the right thing to do to keep her at her dad's,
Mhm.
but then at the same time, we don't know how long that will be, so it might not be logical.
Yeah.
Anyways, so I feel like that one is, I'm not really set in my ways.
Yeah.
Answer. That would be stressful.
Yeah. You want to go on to number 3?
Yeah.
Okay.
So, a woman is going to a physician for an operation that results in permanent birth control. After the operation, the woman can no longer have children. On the day of the operation, the woman tells the physician she's getting the operation done at her husband's insistence, even though she really wants more children. The physician then refuses to operate, saying the bigotry and patriarchy violate his principles. The woman is furious and argues that she has the right to make her own choices, and even though she wants to have children, it is more important for her to follow her religious beliefs, which include obeying her husband. She says the physician should not be allowed to make religious and life decisions on her behalf, and says that he must go ahead with the operation. Who is in the ethical right? What is the most ethical response from a physician in this circumstance? If I were this physician, I would say, no, ma'am, you need to go somewhere else because I'm not going to be responsible for this.
Yeah. I think that's exactly, I think that would be the ethical response from the physician for sure.
Yeah,
I don't think both of them are in their own ethical rights, right? Like
right.
Hers is her religious belief and his is he's sticking to his values.
And that's another one where, okay, so he's going to be responsible in the end. And she, if she then says, well, my husband told me to get it and this doctor did it anyways, like, in the future, if for whatever reason she can take legal action, and then he's just going to have to deal with it. So I would just, that just sounds awful.
Yeah.
But I don't know what doctor would perform surgery.
After hearing that?
Right.
Yeah.
That sucks.
I think because she made it very clear that it's what she wanted, though. It wasn't like ambiguous, kind of like in the first question where it's like she said that's what she wanted, but here she's like, no, like this is my belief, this is my life, like this is what I want, even though I would rather have this.
Even though it's not what she wants.
Yeah. I don't know. I think, okay, say there's no other physician. It's kind of like that pharmacist article that we had to read where it was like, if you're the only doctor within like this many miles or whatever, you should probably try your best to help the patient. If she like believed that strongly and he was the only person around, like he couldn't refer her to anyone else, then he should probably do it if she's that like set in her belief. But if there's a way to like transfer her to somewhere else, then that's probably what should be done ethically.
Yeah, I don't know, because it's not, I don't know.
Yeah.
It because I feel like this is a lot more severe than providing birth control. So I really feel like there's just no way, unless I don't even know how a doctor would perform that surgery. I can't even. She would just need to, after this, when she goes to find another doctor, she'll just need to keep her mouth shut.
Herself.
And then the doctor will perform it. Yeah. I think it's fine that like doctors are just like, no, I'm not doing that. So then obviously she'll learn and then go to a different doctor. But if that is the only doctor in that area or that is available to her, I still think that they reserve the right to say, no, ma'am, because that's a permanent decision, and it will affect them in the future if she changes her mind. Which is unfortunate.
I know, it is. That's a weird one.
Because it's still similar. Oh, sorry.
Oh, no, go ahead.
Right now, a lot of doctors won't perform hysterectomies or anything on women under the age of 35 because of that reason. They're scared that they're going to do it, and then the women are going to be like, I was too young. Why would you do that?
Yeah.
So.
Yeah. No, I was going to bring that up too. That's a good point. But I volunteer at this clinic, and there was this lady that came in, and so I like translate in Spanish for them. And she was telling the doctor that she was there at the clinic to receive birth control, and she needed proof that she went to the clinic to ask for birth control because her husband. No, wait, sorry, I messed that up. She went to the clinic under the guise of like just like going for a checkup, right? But she wanted to, and she needed to bring back proof to her husband that that's where she went. Her husband was like very controlling. but she was there in reality to get birth control. And the doctor was like, okay, well, like, does your husband use condoms? And she's like, no, I ask him to, but he never does. And she's like, she just had a baby. She's like, this is my 6th baby I've had with him. And she's like, I can't do it anymore. And so, yeah, so she was like there to ask for birth control, but she needed to bring back proof that she went to the doctor, but that she didn't get anything else. So it was like such a weird situation. I feel like that's kind of like on the flip side of this one.
Sheesh.
Yeah.
And in that case, obviously you want to help her because
she's your patient. So like, yeah, you have the obligation to help her, but
yeah.
like, what about hiding her medical records? That's kind of like.
Yeah, but it's not his business either.
Yeah.
Because you need to sign consent to share any medical records in the first place. So
yeah.
He doesn't need to know anything. That's sick.
Yeah.
Oh God. That, first of all, also, do you report that as abuse? Because that's sexual abuse. If you are asking your partner to wear a condom and they refuse, yikes.
Yeah.
Yeah, that doesn't sound like a day.
No, yeah. Sorry, I just felt like that was like the flip side of this one.
Oh yeah, where do you volunteer at?
It's a health clinic for uninsured patients in Phoenix.
Cool.
Yeah, so it's pretty. I hear a lot of like these kinds of dilemmas a lot. But,
that's awful.
Yeah.
What is the clinic called?
St. Vincent de Paul. Yeah.
Cool.
Yeah.
That's really awesome. Are you going to med school?
Hopefully. I'm applying next cycle, so we'll see.
Awesome.
Yeah. What are you gonna do?
I'm getting my degree in environmental science.
Oh, cool.
So this is just like my last ethics course that I have to take.
Very cool.
So not working with people.
Yeah. No.
I don't know.
My friend's dad majored in that, and now he's like second at the EPA under Trump.
Ooh.
Yeah, like, so
wow.
Who knows where you'll end up.
That's cool. Yeah. That would be awesome.
Yeah.
Let's see. All right, last one. Where's the timer? Can we see how long we've been on?
Honestly, I think we started around 4:10, so it's been 22 minutes.
So
yeah, but if we need to, I feel like we can like wrap back around to these other questions.
All right.
Yeah,
we'll revisit. Okay, number 4.
Okay. Oh, am I supposed to read?
You can if you want. We don't have to.
Okay. Okay. A controversial case is making its way to the Supreme Court. This is made up, not actual. David is suing because he is being refused a prescription for depression medication. The problem, however, is that David is not depressed. David admits this. However, he says that he was once depressed, which is when he tried the drugs. He had some left over and at one point tried them even though he wasn't depressed anymore. He found the drugs gave him more energy, more confidence, and generally helped him function at his best. He is arguing that the government has no business telling him he can't take a medication that improves his own personal sense of well-being. There's no shortage of this medication, and David using the drug would not impact the ability of anyone else receiving the drug. Some physicians, however, are arguing that this should not be allowed because possible side effects might be harmful. Those side effects are okay if the drug is necessary to cure depression, but physicians argue that they cannot ethically be prescribed when the patient is not depressed. These physicians also argue that allowing it in this case will result in many persons seeking drugs when they don't really need them, and that this might overwhelm the healthcare system. How should the court rule? Is it ethical for David to take these depression drugs? Is it ethical for physicians to prescribe them to David, even knowing that he's not depressed? What do you think?
Yeah, I think it's definitely unethical for them to prescribe it to him, knowing that he's not depressed. It's basically like people that take Adderall for recreation. It's not, okay, yeah, it makes you feel better. That's why you take any drug or drink alcohol or do anything. So that's not a good enough reason.
Yeah, exactly. No, there's no way that they should be prescribing him that drug. Exact same reason. He doesn't need it. And like they said, like the side effects of taking something that you don't actually need, like people who take Adderall when you don't actually need it, it kind of like messes with you too. So.
Yeah, for sure. I was prescribed Ritalin when I was younger, And like it's, the same thing as Adderall basically.
Mhm.
And when I took it, it made me feel like it's supposed to make you feel, because I had ADHD. So it was like I felt like a robot. Like I was just
Mhm.
very calm and
Mhm.
focused.
Mhm.
And I've had people obviously in college that are like, yeah, when I take Adderall, I feel like I have so much energy and I can do anything and blah, 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 blah. I
Yeah.
was like, yeah, so that's not normal. You
No.
should not be doing that.
Yeah, exactly.
And it's also like what? Like what was it? The molecule is really similar to
To meth.
methamphetamine.
Yeah.
Yeah. So what, I don't remember what it was missing in the molecule, but it's like very similar.
Very.
It's missing an ethyl group or something, but uh,
Yeah.
yeah,
It's legal meth, and if you don't need it, then you shouldn't have it.
and it's so strange that it's so close to meth because that's an upper, but
Mhm.
when you actually need it, like it's prescribed to you, it's like a downer kind
Yeah.
of.
Yeah.
Very strange. But
Super
yeah, I
weird.
definitely don't think anyone needs to be prescribed
No. Really.
anything that they
No.
don't need.
No.
So let's see. So the first one we said it's the first
Is
option we
the
do.
yeah, definitely the first option.
I feel like at some point, if you can find a translator, then do what she wants, I suppose. But
There's
I just don't feel like in any case, any doctor would do that, where the mom only has a very slight chance of surviving.
yeah.
Like that doesn't make any sense.
No. Also in this day and age, like we have Wi-Fi. There's literally at the clinic when they don't have enough translators, we literally like pull people up on the iPad and send them into
Mm-hmm.
rooms with people. Like there, I don't know. There's a way to get around all of that for sure. And like you said,
Yeah,
why would you go with the second option as
right. Like if you
as a
can't
physician?
understand her, just
Yep.
do whatever you can to save all of them.
Yeah.
So
If you really wanted to only have the baby's lives like as your priority, then just stay in your country if that's like the norm there, right? Like if that's really, really what you need to be done, I feel like that just wouldn't happen here.
yeah, I would agree. Yeah. And I didn't even read this part. I just went over it,
Hmm.
that they come here so that they don't have to pay for the medical treatment.
Yeah, yeah,
Oh, well, that's
yeah.
good for them.
That's good for them.
I'm happy that people are getting medical care, but that can't be good.
No.
Um, yeah, I would still say the first option for sure, even if we
Yeah.
can't translate. The second one, I still don't know a clear answer, but I think I'm gonna stick with just like take precautions. Like it's already gonna be, these are really important years in the 4-year-old's life, so I just really don't think that splitting her from her mom is going to be as beneficial as they think it will be. Like I really don't think the risk is as high as they're saying it is,
I
or they think it is.
yeah. I think for me personally, if I were the mom, I would just send the daughter off with like a time limit. Like, hey, if this goes on longer than like this amount of time, I feel like at the beginning of the pandemic this year, I would have been like, yeah, she's staying with you for at least a few months. Let's see how it goes. And by this point, honestly, still for me personally, I haven't been going anywhere. I haven't been doing anything. I think I'm
Really?
more, yeah, I haven't like pick up groceries. I go to my parents' house or stay here at the apartment with my roommate and my boyfriend, and like that's it. We haven't been doing anything.
Wow.
So like that's
I
the kind of
I
risk
don't
taker
agree.
I am. But
Yeah,
I don't
I
think there is.
understand.
Yeah, there's like no wrong answer in this. I feel like though.
Yeah, I would agree. I think it's personal choice, and I don't think that there's only one ethical decision in any case, because it's all up to like perception of risk.
Yeah, exactly, exactly. Like,
Yeah, I mean, I don't really do much because I'm obviously like there's no reason for me to go anywhere, but and like I'll do like pick up groceries, and I'll see my I only have like 2 friends, so I'll see them. And
yeah,
but I did go to a Halloween party it wasn't crazy, but it was like more than 2 people. So
Yeah.
I guess I'm taking more risks than I probably should be.
But
But other
again,
than
like,
that, I really just stay home. So
yeah,
it's not like I'm going anywhere else with what I have, whatever I'm bringing around, you know?
yeah, yeah,
And
exactly.
I'm getting COVID tested. Like I just got COVID tested today
Hmm.
just to make sure. And then
Yeah.
I was selected by ASU to go get saliva COVID tested too.
They've
And it says
selected
you
me
have
like,
to.
yeah, they've selected me like
Like,
2 or 3 times. I'm like, I don't even go to campus.
right. Like, why would I do that? I don't want to go.
Yeah, yeah.
And you have to like go into the university center at,
Hmm.
well, like I live next to West. So
Okay.
God, that's so annoying. I don't want to do that.
Yeah, yeah. I'm like
But
literally
yeah,
risking myself to go get tested.
exactly. Yeah. And I get it's for research, but come on, man. I don't want to.
Yeah, yeah, literally. But like what you
But
were
yeah.
saying about like it's like whoever like the level of risk that you're comfortable with. And like what
Hmm.
you said you went to that party, like honestly, that's not the worst thing in the world at all, you know? Like I don't know. So
Yeah. Our other option was to go like out to a bar. They were having like a costume contest and stuff like that. And we were like, um, I would rather be at a place where there's less people, even though people at the bar will be wearing masks, but as soon as they sit down, their masks are off. And
yeah.
then no one puts it back on to go to the bathroom or to walk
Mhm.
outside or you know what I
Mhm.
mean? It's just
Yeah.
chaos. So
Yeah.
I suppose like in that sense, we were more cautious than others. But yeah, it's definitely up to, but in this case, it's like the mom is just working. I feel like the risk is probably just as high as it were before COVID. It's just different.
That's how I feel. I feel like if anyone if this were a situation with like any other kind of like public health worker, I feel like yeah, send it to the dad. But she's a doctor who's worked in the ER for who knows how long. She knows how to
Yeah,
deal. Like I would trust her more than like any random person off the street. Like
right.
so.
Now, if it were like an infectious disease like Ebola that had like a 90% death rate, I would absolutely send the daughter to the dad's house for as long as you need to. Like, there's absolutely no reason to have her
Yeah.
exposed to that.
Mhm.
But then in this case, it's like, you know,
Yeah.
if kids aren't really affected and yeah, whatever.
Yeah. Yeah.
I don't know. I guess I would have to be in this situation to
Yeah,
just,
honestly, yeah, I feel like that's just a case by case sort of deal. I have a friend who's um her aunt and uncle who are like my parents' age, they've both passed away from COVID already. And
oh
like
my
they
God.
were they were like healthy people, like not overweight or anything. Like they're very religious, so it's not like they like smoked or did drugs or any of that stuff. They've yeah, like
How
shocker.
old are they?
Like 40s, like late 40s.
Oh my God.
Yeah. So it's just
Wow.
crazy, right? Because you're just like you just don't know how it's going to affect anybody. Like you said with Ebola, like you were pretty sure like this is exactly what's going to happen, like no matter what. With this, it's like you can get a headache for a few days, or you can literally like die in the ICU. It's like
Right. That's
crazy.
insane. Were they in the ICU? Like they were being treated for a while?
The uncle was there for like 3 months, and then I don't know how long the aunt was there.
That's
Yeah,
awful. Yeah,
I
I'm in
know.
one of my other classes. I have a group, and there's 5 of us in the group. And in the last week, 2 of my group members have had to go to funerals for family members that have died from COVID.
That's so sad.
It's insane.
It's
It's
crazy.
crazy. Yeah. So, I mean, I definitely don't take it lightly at all. And
Mhm.
I kind of stick to like the only, I see the same people all the time,
Yeah.
but I for sure could be trying harder to not go anywhere.
I feel like it's like we also have to again it's like a whole ethical thing, right? Like we have to take our own like mental health into consideration too, because
Yeah,
like
that's most of my thing. Like, I just need to see people. I can't just be here all day. Like, I do school on the computer, work on the computer.
yeah.
I'm in my room all day.
Are you from
Like,
here?
don't.
Like from Arizona?
Hmm.
Oh, okay, so you have like family here too.
Yeah, I'm actually living with my dad and my stepmom right now.
Oh, okay.
But up until recently, they weren't here for like the past 3 months because they are also working from home. So they were like traveling.
Oh, okay.
Um, and so I was here alone for like
Yeah.
3 months. And I was
Yeah.
just, it's just isolating. So
Yeah.
yeah, I think that definitely plays a part. Like you have to just like do something.
Yeah. Yeah.
But
But
yeah,
then,
I definitely think that there's like a spectrum of ethical decisions that, it's not like one or the other for sure.
yeah. No. Then I feel like
But
there's
my friend,
also, what'd you say?
go ahead.
Oh,
No, go ahead.
I said I feel like there's also like definitely higher risk that you could. Okay, like you went to that one party and you were like, I feel comfortable going here. Like I know these people. Cool.
Right.
My boyfriend's friends threw a huge Halloween party over the weekend with like over 50 people went. No one
Oh,
was wearing masks. Yeah, and after that weekend, so like earlier this past week, like three of them had fevers. Some of them were throwing up. One tested positive for COVID. So like now everyone else had to go get tested. And then like that's crazy, right? But then they were talking in the group chat, and one of the girls was like, "Oh, guys, I tested positive for COVID," and everyone's like, "Oh my gosh, really?" And she's like, "Yeah, this is going to be such a great bonding experience, haha." So I feel like there's just people who just don't care either. I realize that's a whole other like side of it too.
they
So
just think that it's not going to be anything, which,
yeah,
that's fair,
yeah,
but at the same time, you just need to be prepared. My
yeah.
friend, this just happened. So I had to get tested today because one of my friends yesterday came over to my house, the one that I see all the time, and
Yeah.
she came over and didn't say anything. And then, like a few hours into us hanging out, we were going to our other friend's house, the other
Mm-hmm.
person that I see all the time.
Yeah.
And she was like, yeah, it was so weird. Today I went to go get my flu shot, and when the physician took my temperature, they said I had a fever. I was like,
And she didn't bring it up
you're
at
telling
all.
me this now? Yeah, I was like, why are you here?
Yeah.
And she was like, yeah, but I think it was okay. And then she's like, then I went to a work event. I was like, you went to a work event? Like, what's wrong with you? And then so that she convinced me, I feel fine, blah, blah, blah. So
Mm-hmm.
I was like, all right, that's fine. We went over to my other friend's house, came back home, she left, everything was okay. And then she texted us this morning and she was like, hey guys, I couldn't sleep last night because I had chills and blah, blah, blah. Yeah.
Oh
She's
no.
like, I'm going to get tested. I think you should too. And I was like, that's so irresponsible of you to put us at risk. And I'm so angry
Yeah.
because now I live with my parents.
Mm-hmm.
Our other friend, her sister has a newborn baby. Like, it's
Stop.
just right. So I'm like, and she's like, I feel so bad. And I was like, you should, because you
Yeah.
needed to tell me that before you came to my house and exposed my whole family. Like,
Yeah.
yeah. So I went and got tested today, and then she got tested. So I'm waiting for her results to come back. And then if she comes back positive, I'm going to go back in like a week and a half and get tested again
Yeah.
to see. So,
Yeah. Oh my
so,
gosh.
so ridiculous. Yeah. So
Yeah.
even people that you do trust, it's not always,
Exactly.
yeah.
Exactly.
So,
So it's like this is what I always say. I'm like, you can always control what you do. You can't control what other people do. So it's like
yeah.
trust who you trust, and if they, that's kind of up to them from that point on. So it's like, dang, that's crazy though. I feel like the one thing it's like if you have a fever, you shouldn't hang out with anyone right now.
She's just, she's, I don't know what she was thinking. And she was like, she said that when she went to her work event that they did a temp check at the door and they said that she had a fever, but then they were like, okay, but like go sit down and cool off and then come back. And she did. She came back and then they tested her again and they said she was normal. So I
Mm,
guess that put me at ease a little bit because I was like, okay, well, if you have a fever, it usually doesn't break within like 2 minutes, like when you want it to.
yeah, yeah,
So it kind of made me feel better. And then like the chills thing, I was thinking it could be an adverse reaction to the flu shot.
I got my
Um,
flu shot last week, and I got home and passed out. I was
yeah.
like achy. I felt so gross. So like it
Okay.
could just be
So
that.
yeah, that's
Yeah,
completely normal too. So, and that's what we were talking about. And she's like, I hope it's just a reaction. But I was like, yeah, but you did have a fever. It was recorded twice that you had a fever.
yeah, yeah,
Anyways, we'll see.
yeah. Well, good
If
luck.
I
Hope
told her, I was like,
everything.
I told her if I get COVID, I promise you, you will not hear the end of it.
Yeah,
I will blame you to the day I die.
yeah.
And if my parents get it, oh my God.
Right. That's
We're
a whole
trying not
other.
to think about that.
Yeah.
Yeah.
No. Good vibes. You'll be fine. It's okay.
Thank you.
Yeah.
Yeah, hopefully. But yeah, so that one it just depends on the circumstances for sure. I keep wondering like when we're going to feel safe again. Like
I
when
know.
it's not gonna, you can't just snap your fingers.
Yeah.
And there's no cure. For the flu, there's not even a cure. It's just treatment, and people still die from it. So,
Yeah.
like, how are we going to mitigate this in the future?
Once we get a vaccine out, that'll help. Obviously, not everyone takes the flu shot every year, anyways.
Well, now hopefully
But
people will do it more often. I never did it just because I never thought about it. I was just like, well, so my mom was a nurse for a long time and she had to get hers, but then once she stopped getting hers, I stopped getting mine because I was just like, there's no point. I don't need to. My mom doesn't work in a hospital anymore.
Yeah.
But now I'm realizing, obviously, taking a bazillion science courses and understanding herd immunity, and everyone needs to be a part of it for it to be working efficiently. So now I'm like, okay, I need to definitely get that.
Yeah.
And then it's scary though, because even once we get a vaccine, everyone's saying that they're not going to take it.
I know.
Like they're more scared of the vaccine than they are of the actual virus.
I know.
And they're going to screw all of us.
I know. Did you, someone on the first discussion post, I hope the professor's okay with this. We're trying to keep it ethical.
I think it's supposed to be like, open comments. Like we need to relate these things.
Yeah.
And this is super relatable right now. These things, ethical decisions are coming up every minute of all of our days now.
Literally. There was, in that first discussion post, someone posted that it was like, should we fully trust physicians or something? Like the first comment, I don't know if you read it. He said, basically, no, we shouldn't always trust physicians, this and that, and this and that. And he was like, especially like when it comes to shots, because shots cause autism.
I responded to that one.
Did you respond to that one?
I responded to your
me? Oh, yeah, that's you.
I did. I was like, wow, thank you so much for saying this, because I would have said it much worse. Like, you're in college. Like and this is what level class is this? 400?
300? 400? Still, 300? Yeah, for division.
And it's a science class. So you should know research techniques and how to prove a theory. And there's no proof for that theory. What is wrong with you?
But what got me, I was like, I could care less what you think. Like, I don't know if he posted that just to like rile people up or something, like, who knows. But what got me was like the people commenting like, oh, I didn't know that vaccines cause autism. God. I was like, no.
Here are some resources.
Please don't.
Yeah, I did. I saw someone was like, wow, thanks. I didn't know that. What?
That one scared me. I was like, no, like I could care less what you said, but like not you, but the original poster. I was like, don't like spread this like misinformation without even like backing it up. Like I feel like that's another huge thing right now is like misinformation. Like what do we trust and what do we not trust, right?
Have you been watching the president?
Yeah.
Like it's insane. And people, my dad and I were talking about this, and social media has been so wonderful. Obviously, we're using it right now to communicate through a pandemic, but then at the same time, it's so easy to spread misinformation. It is so easy for people to be lazy and read what they see on a discussion post about how shots cause autism and then pass it on. It's insane. And then now with the president saying, oh, it's fraud, blah, blah, blah. There are actually, and I did not think this would happen. I thought people all, like even Trump supporters, I thought even they would know that that's not true, but they don't. It's insane. They're really like, wow, I can't believe you guys would do this, and I can't believe you wanted to cheat. What? Anyways.
I think that's a whole other thing. I just don't get it. I'm like, at the very least, we have to trust, or not have to, but we should try to trust our government, like our election system, right? Because like at this point, it kind of is what it is. So it's
Right.
like,
We don't really have a choice. And
yeah.
previously, like, okay, and so here's something that I was thinking about. In 2016, there was recorded proof of Russian interference through Facebook, right? Right. Nobody said anything on that side. Nobody. And Donald Trump was impeached because of these things, and nobody said anything. And now there's no proof of it, and all of them are crying about it. Like, wait a second, where were you guys? Do you remember? Like,
wait, wait. I'm so happy you brought that up. He was literally impeached by the House.
bro.
I'm sorry, by the House. He was impeached by the House and found not guilty by the Senate, which is majority Republican right now. So it's like, obviously there's no bias in there.
Right.
It's just like crazy. I just don't get it.
It's just, there's no reasoning. And that's what it is. Like, the same people that say, you know, we shouldn't trust our doctors are the same people that are saying we shouldn't trust our government. And they have nothing behind it besides these conspiracy theories. Like, I understand being cautious.
Mm-hmm.
And with doctors, I have had bad experiences, but I don't think I think that the doctors in history, like the ones that we read about the first week from the Holocaust, like, well, first of all, that was very specific time in history where so many incredible, horrible things were happening.
Mm-hmm.
But I think it's like 1 in a million where there's a doctor that's actually trying to be nefarious, like trying to hurt people. And otherwise, it's like they're human and they make mistakes sometimes.
Exactly.
You know?
Exactly.
So I definitely would say you can trust our doctors and trust our government. I think you can question the government, but I don't think that they're out to get us.
We have rights here, right? We should be able to question our doctors. We should be able to question our government, but like to totally just outright distrust, that's a whole other.
If you have something behind it, if you're like, oh, I have proof of this happened and this doctor was doing this or the government was doing this, then that makes sense.
Yeah.
And it should get attention. But otherwise, it's kind of just like, I don't really know what that fear is. Like, people like being scared, thinking their doctors are out to get them or the government is out to get them. I'm not sure what that is.
I feel like that's the whole like paternalism, at least for the medical field. It's like paternalism, like you know that they know way more than you, and like that can intimidate people.
That makes sense.
Yeah.
It is interesting though, because so I was diagnosed with Lyme disease last year.
Oh, wow.
I don't know if you know much about Lyme. No one really knows anything about it in Arizona. And it sucks. So mine is chronic because I had it for so long and no one knew what it was. And I didn't know because at first I wasn't doing my own research. I was expecting them to just know.
Right.
And once I started doing my own research and finding all of these possibilities, I actually had to go to my doctor and say, I need you to test me for this. And he didn't even want to. And I was like, you need to. I will pay whatever you need me to pay. You need to test me for this. And then sure enough, it came back positive. And I was like,
wow.
So if
you diagnosed yourself.
Pretty much. If I wouldn't have been that crazy person that everyone makes fun of going on WebMD, then I would still be undiagnosed and untreated. Like it would be worse by now.
Yeah.
So it is, I understand, but it wasn't his fault. Like he was born and raised in Arizona. Nobody here knows anything about it. Like, you know, it's not something that's really common. It's becoming more common because of global warming and ticks are everywhere now, but like it's an East Coast thing mostly.
Yeah.
So I get it, but it was an honest mistake. It is crazy though.
That's
and
crazy.
It makes it easy to be like, they're out to get me, or they don't care about me. They're you know, they're only in it for a profit. He just wants to prescribe me medicine. So
there's so many. That's crazy. I'm so happy for you that
thank you.
Like, because wow,
I've always been like, you know, self-advocating is important in the medical field, and but it's discouraged all the time by doctors.
Yeah.
And by one time, this woman, first of all, completely unqualified. Like, I'm more qualified than her to be giving advice. And
Yeah.
she was, there was a woman at the front office at the doctor's, and I said, I was speaking with my mom, and I was like, well, there's like an online community that I belong to. It's like Lyme disease, people that have chronic Lyme. And I was saying, oh, well, my symptoms are really common and a lot of people, experience them. And this woman was like, my mom was like, well, where did you hear that from? And then I told her, well, it's on this online group. And this woman was like, no, that's your first mistake. You should never go online for answers. I was like, that's exactly what the internet is for.
Wow.
Why on earth would I not do that?
Yeah.
And so, and it's just,
Yeah.
it is, I get that people don't trust them, but yeah.
Yeah. I think that comes down to, I feel like a lot of people mention this in that first discussion board too, is like, that's when the whole like patient doctor relationship comes into play. Like, do you really trust your doctor? Like, do you really feel like he or she has your best interest? Like, and that's, because obviously not everyone's going to have your best interests at heart, but also not everyone's going to be out to get you.
Right. That takes a lot of energy to be out to get you,
Yeah.
So yeah, I think it's important. And you have a choice most of the time, like who you want to see. Even if you don't have a choice, like what provider you can see, you can still usually choose like your PA or something. Yeah. And I went through a bunch of them, and then I finally found one that I really liked, and I've stuck with it. So I think it makes, but like I said, it makes sense. Like, people don't trust them, but I definitely don't think they're evil.
Yeah. Wow.
So yeah, good luck. You're gonna have a good time. So what are you gonna go to medical school for?
Hopefully like developmental peds. Like I said, I work with kids with autism right now, and obviously it's different work, but it's kind of all related to the same
hard work
topics. Yeah.
That is difficult.
Yeah, I feel like what we're just talking about, the whole patient doctor relationship. For me, it's like client provider relationship, right? And it's like you just have to really, like you said, put in that energy and put in that effort, because like each kid is different. So it's like you have to like learn how each one works and what works best for them. And I feel like that's hard when you're a doctor and you're trying to get through 40 patients a day. Like, that's a whole other issue. Yeah,
they're human first. And that's also terrifying to think about, because we put so much on them. Like, people will, so one of my friends will always be like, before I was diagnosed, she would always be like, how do they not know what's wrong with you? And I'm like, well, how will they know? What else can they do? There's only so much you can do. So kudos to you though for wanting to pursue that. Working with kids with autism, one of my friends was she got a degree in psychology, and she started doing that. And she couldn't handle it. She was just not
really
cut out to do that kind of work. I guess maybe, I wouldn't say she's like too emotional, but she was just emotionally exhausted from it. Like, she just felt like she wasn't doing enough. And she said that she used to get peed on every day. And
I've been bitten, I've been punched and kicked.
But I'm like, honestly, that is no different than working with normal kids, because I used to be a swim instructor, and I used to get puked on all the time. Peed, slapped. Yeah, like, it has nothing to do with what kind of kids, it's just all of them.
Yeah.
So, but yeah, that's really cool. Did we?
I feel like we're there. The permanent what?
The permanent birth control.
Yeah, we did.
No, I mean, like, did we circle back on it?
Oh no, we didn't circle back on it.
I'm trying to, like, we should probably get the rest of these in.
Yeah.
Our professor's gonna be watching this and be like, okay, ladies.
I know. She's like, guys, we tried.
Yeah. This one, for me, it's cut and dry. It's very simple. The doctor should not be doing anything for this woman. If she hadn't said that it wasn't her choice, then that's perfectly fine. But because she did, like, that's completely unethical for him, at least, to, in my opinion, to do that, to go through with it.
I think that's the conscientious objection, which he has the right to. And then also that's the whole oh geez, it left. I was in my mind and it ran away. It's gone. Nope. Dang.
Trying to see if maybe I can like figure out what you were gonna say. Don't know.
Still. Oh, it's also not there was something that we read. It was like not cause for emergency. Like
Yeah.
like not, it doesn't need to happen like right away.
Yeah, right. Yeah. And in that case, like I was thinking that as well. Like, okay, well, this is not an emergency life-saving operation. It's by choice.
Mm-hmm.
But then I was like, okay, at the same time, birth control is also by choice. But I also think the severity of the two make the decision much heavier.
Yeah.
So
one's
it's
irreversible.
Yeah, one of them is irreversible, and it is a serious surgery as well.
Yeah.
That is not something that's easy to recover from.
Mm-hmm.
Birth control, you can just
Yeah.
stop taking it.
Yeah.
And it gives you so many benefits.
Yeah.
So yeah, I definitely think that the ethical decision would be no.
Yeah.
I wonder how often that happens.
I don't know. Yeah, I don't know. Like I said, I've heard some crazy stories. That I feel like the one woman, that one like really sticks out to me. Cause it's like we can't do anything for her. We asked her if she wanted any, because at the clinic they also provide, like you said, sexual and assault like therapy or like hotlines and things for them. Also, like if you've been kidnapped, like they offer those kind of services too.
Wow.
Yeah, like
great.
Yeah, but she was like, no, I just please give me the birth control. So it's like she didn't even know that it wasn't like right. You know what I mean? Like she was just so used to it. It's like heartbreaking. But
it sucks when, I mean, you can't do much in that situation because you have to have her consent to move forward, and you don't want to put her in danger by like reporting it.
Exactly.
And then the police come, and then yeah, it's a whole debacle.
Yeah.
Man, that's awful. That's another ethical conundrum as well. Like, okay, so am I helping by reporting this situation as domestic violence? Am I helping by ignoring it and just doing what she asked me to do?
Yeah. There are some awful people out there. I'll just say that.
Truly. It's insane. I think that would have been the ethical decision though, like just keep quiet and help her in a way that you can. Because if she's not willing to take steps to help herself, then you're just going to make it more difficult.
That's what exactly what the doctor said. That's what he said. Because he could tell I was kind of like, you know, like, what do we do? He's like, we can't do anything. Like, we have to remember like what our job is first. Like, that's what he told me. Like, my job as a doctor first is to treat her health needs. And I can offer her anything, but she doesn't have to take anything as well. So it's like, dang. Yeah.
That's rough.
Yeah.
This last one is also really cut and dry too. I think we both agreed. It's ridiculous to even
if he really wanted it. Yeah. If he really wanted it, like we said before, just don't say that you don't need it. I feel like if you need to play this,
go get diagnosed.
Yeah.
Yeah. Or you could probably buy it from a drug dealer.
Drug dealer in Mexico? Go to the pharmacy in Mexico.
That's true. But like, I'm almost positive that depression meds do not make normal people feel good. I'm almost positive they do the opposite.
No, they do. That's why this was made up for sure. No, it like literally, I think it increases your risk of like suicidal thoughts. Yeah.
Yeah, for sure. I've been on depression meds for like 12 years. So it's like, when I was very, very young when I started them, and that's what everyone was scared of, because they didn't know if it was like, oh, I was just going through puberty, or if it was really depression. They were like, that was an ethical conundrum as well. They're like, if we give this 12-year-old antidepressants and then she becomes suicidal, that's not good. Luckily that didn't happen, but you got
the help you needed.
Oh, for sure. Yeah, I can't imagine someone taking them for fun though.
No.
Same with Adderall. I don't understand. It's very strange to me.
No. I take anxiety medication, and it's like it mellows me out. So I don't know what that would do with someone who doesn't have it. Like, I feel like that would just make them anxious, no? Like,
I think it's similar to antidepressants because my antidepressant is also an anti-anxiety, and like it was like a similar, I think it can increase like suicidal thoughts, like it can make you depressed if you take it and you don't have anxiety. Yeah, I don't know, like just go be normal and like, I don't really say anything inappropriate.
I know,
today, but just go do like a recreational drug.
Yeah,
you don't need
yeah.
you don't need to go through all this trouble, David.
Prop 207 just passed. Go, go do your thing.
Go to 27th Avenue in Indian School. You'll find something.
I think we're good on time. I think we might have just hit a little over it too, actually.
Perfect.
Yeah, cool.
Hopefully, most of this stayed on topic.
Yeah, I think we did a good job. I
would agree. I think everything that we talked about had something to do with these.
Yeah, we tied it all back together. I'm gonna pause this really quick to make sure that it says recording, but I don't want to just like hit stop. So thank you, Professor. We will submit this.
Cool. Is it done?